Top of the hour. So Cari, why don't you go ahead and advance the slide for us, and Rick is going to start the recording. Welcome everyone. I'm so pleased we have so many people here, and we're expecting a few more that I'm guessing will be jumping in. My name is Sarah Crimans, and I'm an extension educator with the University of Minnesota Extension and our Center for Family Development. And I am so pleased that all of you are joining us today for the webinar, Exploring the Mental Health Pandemic and How to Respond to It. Today, our presenter is Cari Michaels, and she is a public health educator who works in partnership with leaders across campuses and community organizations to promote mental well-being. Cari has been doing this work for quite a few years, and 25 years, and she has served in community and university settings to strengthen families and children. And Cari works as an extension educator within our University of Minnesota Extension Center for Family Development. So Cari, thank you so much for being here today and presenting.
Thank you, Sarah.
And I was going to mention two other things before I passed it on to you. We are recording the webinar, and we will be sending a follow-up email to everyone either today or tomorrow. So watch for that. And in that follow-up email, you will get a PDF of the PowerPoint slides, as well as links, all the links that Cari will be sharing in the webinar. And then the second thing is at the end of this session, at the end of the hour, we will be sharing an evaluation link, and we would love for you to provide feedback for us. And if you are in need of a certificate of participation, or if you are searching for those University of Minnesota Wellbeing points, you will be able to access those by completing the evaluation. So watch for that eval at the end of the webinar. So now I'm really going to pass it over to Cari. Thank you.
Thank you, Sarah. And thank you all for joining today and for sharing your barriers in the chat. First, I just want to congratulate you on taking some time to focus on your own mental well-being and that of others around us. This has been a growing field recently, but especially during the last 2.5 years, as you may know, many have called what we're experiencing now an unprecedented mental health crisis. So we will dive more into that during this next hour. I'm glad for the opportunity to talk with all of you about this important topic. And in a few moments, I will come back to the barriers that you're sharing in the chat. Sarah said a little bit about me. I am a public health educator, and I'm with the Center for Family Development at the University of Minnesota Extension. And so I focus my mental well-being on individuals and families, communities, and organizations. Throughout my career, my programs and interventions have been to strengthen children and families. And I think that the discipline of public health has a lot to offer this fast-growing field of mental well-being. I'll talk more about that too. I would like to thank Rick Meyer, who is on the call today and is here to manage any technical issues. You can reach out to Rick in the chat if you have concerns or questions about technical issues. He will also be helping to monitor the chat, and we'll be sharing some of the resources that we talk about as we move along. This session is about taking stock in the experiences that we're facing right now that affect our mental health and learning strategies to understand and care for ourselves and others in our communities. This is a process that can take time, and it can become a way of life. It's not an instant thing. For some, it might present a different way of looking at mental health, and for others of you, it might serve as a reminder of the importance of putting our mental well-being as individuals, as family members, as colleagues, as citizens, at the forefront of our focus. As we all know, there has been and continues to be a fair amount of stigma associated with mental health and well-being. This means that people struggle not only with their situation, but also with the prejudice, social rejection, and barriers sometimes to seeking support. My hope is that stigma will decline as more and more of us are coming together and talking about mental wellness. Here are our learning objectives for today: to understand current mental health struggles through the lenses of loss, grief, and trauma, to distinguish between the terms mental illness and mental health, and to identify mental health interventions through an ecological perspective. We are aiming to better understand all of these with the perspective and an understanding of the situation that we're facing right now. So we're going to dive into that more deeply. And now, thank you for sharing the barriers to your mental health. I saw a lot of them related to caring for others before you care for yourself. And I hope today we'll have a little bit of a reminder of the simple ways that you can care for yourself throughout your day. A lot of others too here in the chat. Being stuck in survival mode, being unable to stop and do proactive self-care, very common, especially now. Stressful jobs, mom syndrome, meeting the needs of a developing toddler, yep. And others have mentioned meeting the needs of elderly parents. A lot of us are in roles of caregiving, balancing work, home, personal time, all of that, very good. So many of us have lots on our plate, and just taking this hour is helpful in reminding us, oh yeah, right, I need to care for myself before I can care for other people. So thank you for being here. And then one of my current barriers is consistent sleep. I believe that sleep is foundational to our well-being, and I have a hard time doing what I need to do for consistent and sound sleep on a regular basis. In light of these barriers, and before we go further, I invite you to join me in a mindful breathing exercise. This activity that we're going to do today is called box breathing. Box breathing, mindful breathing, first of all, can help us let go of the past, forget about the future, and ground us in the present moment. And it's particularly helpful during times of acute stress. Box breathing is easy to understand if mindful breathing is a new practice for you, and it's easy to do together over Zoom online. So feel free to join in or step back as it works for you. If you are sitting, I invite you to straighten your back, rest your feet on the floor, and pull your shoulders a little bit back and down, and just generally relax your body. I will be drawing a box in the air, and we'll practice this first. We'll breathe in through the nose while I draw the first side. We'll hold while I draw the second side. We'll breathe out through the mouth while I draw the third side. And then we'll hold again for the fourth side. And we'll practice it once, and then we'll do it 3 times. So here we go. Breathe in through your nose. 2, 3, 4. Hold. 2, 3, 4. Breathe out through your mouth. 2, 3, 4, and hold. 2, 3, 4. Breathe in through the nose. Hold. Breathe out through the mouth. And hold. Breathe in through the nose. Hold. Breathe out through the mouth. And hold. Thank you for joining me in this exercise. This is one of the many mindful breathing activities that we are inserting into classes as a way to center people in the space and prepare for learning. And we can share this and other mindful breathing exercises with you at the end. First, we are going to dive into the difficult job of examining the situation that we're facing right now. Overall, the spread of disease and death that we have experienced as part of the COVID pandemic is associated with fear and grief and resulting mental health struggles. We have experienced high levels of social isolation, so we'll also look at how this plays a role in our mental well-being. The basic needs of food security, housing security, employment are all related to our mental well-being. Rates of anxiety and depression among US adults and youth have increased significantly during the last 2.5 years. And many people are untreated for their mental health struggles now as they were before the pandemic began. The pandemic has resulted in one of the worst nationwide mental health crises in many years. Here we have percentages of US adults experiencing these mental health conditions during 2021. This represents conditions that are diagnosed and for which people have sought help. And as we can see, this is a subset of everyone experiencing mental health struggle. Over half of US adults with a mental illness don't actually receive treatment. We won't know the true numbers of people with diagnosable mental illnesses that they attribute to the pandemic for some time. But what we do know is that the number of people who are seeking help for anxiety or depression has skyrocketed. The use of online screening tools for mental health conditions has increased. So people are trying to figure out what's going on their own. And the use of outpatient services has increased. And then a significant portion of adults seeking treatment have not been able to find it. Many sources state that in a given year, about 20% of US adults experience a mental illness. Also, these numbers have increased during COVID. These are rates of anxiety and depression, and they've actually paralleled the COVID outbreaks. This same study also shows us how, as we have run this marathon of COVID and experienced these rising rates of mental health struggles, the healthcare providers that are tasked with helping other people have experienced this struggle as well. So when people do reach out for help, they sometimes have a long time to wait. Many have called this a mental health pandemic, and it'll take some time to move through it. There will likely be lasting effects, and taking care of our mental health as individuals is that much more critical. The virus has also exposed and increased existing inequalities of wealth and gender and race. People of color have experienced a particularly high physical and mental health toll of this pandemic. This shows death rates among different racial groups. Because more people in these populations have limited access to healthcare and financial resources and greater exposure to the virus due to occupation, roles like frontline workers, essential workers, and critical infrastructure workers, or housing conditions that promote spread, they have experienced more sickness, more hospitalizations, and more death. Here's one way to look at what we're experiencing. We first had the physical health crisis of the pandemic. Then we had an economic crisis. And then we realized we're experiencing a mental health crisis. The mental health wave that we see here is large, and the tail of it will be a lot longer. We can expect for some time to continue experiencing the mental health fallout of stress and overwhelm, isolation, closed schools and businesses, and so on. In searching for theories or frameworks that might explain the mental health issues that we're experiencing, I found one that's particularly helpful and relevant, which is the concept of ambiguous loss. This idea was developed by Dr. Pauline Boss at the University of Minnesota. She has spoken quite a bit about ambiguous loss as it relates to the pandemic, and she's written a new book that's out this year called The Myth of Closure. Here are two books that she's written related to this. First, ambiguous loss is a loss that remains unclear and full of uncertainty. We don't know all the facts. Regarding our situation right now, we don't know how COVID will remain with us into the future, exactly how effective our vaccines and our booster shots are, how we should re-enter social spaces if we've been isolated. The future is also unknown. We don't know when and if this pandemic will end completely. We don't know how our economy will fare or bounce back. And we don't know how our youth and the next generation will be affected. Also, the loss can't be clarified or cured or fixed. We have things we can do to manage this pandemic and to manage ourselves as we move through this pandemic, but we can't make it go away. And ambiguous losses can be physical or psychological or both. And we have many types of losses this past couple of years. Financial losses, loss of family and community, loss of rituals and routines, things that gave us structure and engagement with the world we couldn't do in the same way. The world is not a predictable place. So if it was predictable for you before, it might not be anymore. We can have a loss of trust, loss of control over our daily schedules, freedom loss, loss of safety. And then, of course, there are the significant losses of illness and death. And even then, we have a loss of not being able to be with people and mourn in the typical ways that we would. With ambiguous loss, you don't know how much more you might lose. There's no closure. So you don't have markers to identify what you've lost, and there might be more coming. Dr. Boss says that naming the problem of ambiguous loss helps people understand that the stressor here is not just the virus, it's also these many ambiguous losses that go along with it. So I'm going to ask you some questions as we move along. Some will be a poll like this one. Some will be for the chat. and some will just be to note to yourself. This first one is about what types of losses you've been experiencing. And as you think about that and respond to that poll, I will share my response. For me, I've been fortunate to retain good health and employment. My answer is really about social connections, specifically being connected to the older generation in my family. My mother-in-law passed away this past year, and my mother is now receiving hospice services. And I didn't expect their end of lifetime to be so isolated, so different from their earlier lives. So that's a main loss for me. Thank you for your responses to the poll. I see that we have losses of all types, which doesn't surprise me. And it looks like there's a whole lot of people talking about loss of social connections and relationships. And as we will talk about, that is part of the definition of mental well-being. Loss of health, loss of unemployment, few people talking about loss of housing and food security and other daily needs, loss of rituals and routines, and then quite a few people too talking about loss of security and predictability. Those are all very common, and we'll talk about moving through the emotions that we have related to these losses as an important part of our mental well-being as well. Thank you for sharing these. I am sorry that we're all experiencing losses like these. I hope we can find some comfort in the fact that this is a very common experience for us right now. I am just having a difficult time taking my poll down. All right, sorry about that. Because of the losses that we're experiencing, we are also experiencing high levels of grief. By definition, grief is a feeling of sorrow, suffering, or distress. It's usually based on a significant loss. We might experience grief associated with any of these losses that we just noted. And it's not surprising if we feel common grief reactions of shock, denial, anger, anxiety, periods of sadness, loss of sleep or appetite, and unpredictable changes between all those feelings as we move through our days. And this has also been a time of isolation and loneliness. Social isolation technically means having few relationships or infrequent social contact. Loneliness means feeling alone regardless of social contact. In this country, social isolation was already identified as a major public health concern before the pandemic even started. And the number of people who have been feeling lonely have increased as time has gone on. Interestingly, in the United States, it's younger generations that are now reporting more loneliness than older generations, and that's a change. That might be partly due to living alone, increased technology use. I have also read that some young adults report the absence of anybody reaching out and checking in and seeing how they're doing in a meaningful way. Isolation and loneliness affect our mental health, certainly. It's related to things like depression, anxiety, suicidality, and sleep. But it also affects our physical health. Loneliness is associated with cardiovascular disease, diabetes, obesity, immune system issues. It's associated with cognitive health, our general cognitive functioning, and dementia and Alzheimer's disease, and our economic health. People who report loneliness also report more medical spending, lower productivity at work, and more absenteeism at work and school. Many of these symptoms have worsened during the time of COVID. And then finally, for many, this has been a time of trauma. A person can face trauma when they experience an emotional response to a terrible event, such as when they are subject to or witness illness or threat of illness. And traumatic events are defined not only by the event, but also by the person's perception of it as overwhelming. The pandemic, of course, is a threat to our health, and many have talked about how overwhelming it is. I think I've heard that word more in the last couple of years than I'd ever heard it before. Also, the murder of George Floyd and those that came before and after his have increased awareness of trauma and related mental health struggles. Gun violence has also contributed to rates of trauma. You don't have to experience this directly to feel the effects on your mind and your body. Some people and communities have long-term experiences with trauma due to racism, hate, oppression, and discrimination. For many, this type of trauma has been long-term and generational. It's not new. Many more people are also now aware of the effects of trauma on people and on whole communities. So part of supporting our mental well-being for ourselves and our communities is about addressing trauma. Our language around trauma in research and in practice is changing as more people understand more about it. People understand the importance of addressing trauma at the beginning of a mental well-being journey. Now, healing-centered approaches to addressing trauma are more common. And we also know that trauma is not just about individuals. An individual is about more than their trauma. Past trauma does not define us. And trauma is about more than the individual. Both trauma and healing can be and often are experienced collectively. So we can work with families, organizations, and communities to identify and heal from trauma, not just with individuals. All three of these, ambiguous loss and grief and trauma, can affect our window of tolerance. First, consider the middle of this picture. When you are within your window of tolerance, you can deal with what you're experiencing. Bad things are happening out there, but you have the resources to respond to them. The window of tolerance is shown here on the left and the right in yellow. When pandemics or violence or isolation or trauma happens, our window shrinks, as on the left-hand side. That happens to many of us. It's easier for us to experience either hyperarousal, where we can't calm down, or hypoarousal, where we're shutting down and we're struggling to stay engaged. We might be depressed. But as we expand our window of tolerance, as on the right-hand side, with help and support and self-care, we'll talk about that in a bit. We can expand and by caring for ourselves, and then we can better manage what's happening around us. Mental health promotion includes many types of work. It's important to change the big picture situations that affect the mental health of entire populations or generations. And also it's important for me, at least, to increase my own window of tolerance for the things that are outside of my control. If I can regulate myself when I face stressful and traumatic situations, then I can keep doing the work that can change the bigger picture for everyone. So what is mental health? People in different places and cultures understand mental health and mental illness in different ways. There are varied definitions, perspectives, and language. Mental health is a cultural concept, and we think about it differently depending on our families and our communities. I'm going to share some thoughts about how the general understanding of mental health for many, has changed in the United States in recent years. In general, we used to have an old mental health narrative, which stated that mental illness is exclusively a brain disorder, and specifically about chemicals, which are caused by genes, which are set in stone for life. The old narrative also said mental health and mental illness are the same thing, and that mental illness is a medical condition that can only be addressed by a medical professional. That medication is the logical response for everyone, and the treatment is designed to temporarily rebalance chemicals. So there's no ultimate cure for mental illness. There are ways that we can treat it. The old narrative also said mental illness is a character flaw. There's no room for how environmental influences affect functioning. It said that mental well-being is the same as happiness. It's about emotional health only, or having positive feelings. And then it said that mental well-being is a choice, that people can make themselves better if they only try hard enough. Now, fortunately, we have a new narrative, and that old narrative was based on a national survey done by the Frameworks Institute. This new narrative is taken from the Minnesota Department of Health, and it is based on new research and new intervention practices, reduced stigma, and more open conversation. And the new narrative says, brains are built through experience. Changing our experiences can change our mental health. Fear, trauma, and chronic stress negatively impact our mental health. We can sometimes improve mental health by focusing on these. The environment where we live, work, learn, play impacts our mental health. Resilience is not enough in the face of oppression. Recovery isn't just about individual grit or strength. Physical health and mental health are intertwined. Culture shapes our definitions and our understanding of mental health. Language differs, treatments differ, recovery differs. Positive relationships are central to mental health. They promote healing. Mental health actually happens in and through relationship. Mental wellness happens in and through community. It's not just about the individual. And mental health requires a sense of purpose and power in your life. And I would add that everyone has a role and responsibility in promoting mental health. It's not okay to relegate this field to those who are here to treat illness. We need those people, and they have the credentials and the licensing and the education to do that. But we all have a role to promote mental health. I am excited about this shift. It allows us to address mental health promotion in addition to treating illness. And I think that the shift in conversation between this old narrative and the new narrative really helps reduce stigma. So next is a question for the chat. What about this new narrative resonates with you? What might be new or something that you could keep in mind to support your own mental well-being? And I'll go back to the last slide so that you can see the new narrative. And as you're thinking about that, if you could put your thoughts in the chat. What about this resonates with you? I will share my own thoughts. For me, the importance of relationships really resonates. Personally, I'm an introvert, and I tend to turn inward to handle struggle, but sometimes I really need to push myself to find outside supports. And then professionally, I'm reminded that it's not sufficient for me to spend all my time and energy on helping individuals reach mental well-being. It's also important that I address people's need for social connection, that is part of my work. We are well in relationship with one another. So I see that we are getting some comments in the chat. Thank you for those. The importance of environment, physical and mental health are intertwined, mental health through community. New narrative fits my personal experience a lot better, especially resilience is not enough. And I do think we can get into blaming individuals if we don't call ourselves up on that and recognize that it's not just about individual strength or grit, but it's actually about a lot of other structural and systemic and social issues. Positive relationships, sense of purpose and power, brains are built. Very good. We're getting lots of comments, a lot about positive relationships. And it's partly why this pandemic has been so painful for many people. We haven't been able to have those relationships. Mental illness is not stagnant. We'll talk about that more in a little bit. Thank you for all these comments. We've got lots of things coming in. Environment matters. Yep, resilience is not enough. So there's lots of things here. And I think really this list is growing rapidly as more and more people are studying mental health promotion. So I appreciate your comments. Thank you for sharing those. I will move ahead here. Along with this new narrative, we have a much broader definition of mental health. This is the World Health Organization's definition, and it states that mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. A visual way to help us begin examining this new definition is this model, which was created by Dr. Corey Keyes, who is from Emory University. I use it a lot, and I think it's kind of the foundational idea in this session and other sessions that I give on mental well-being. We used to think of mental health and mental illness as the same thing, or maybe opposite ends of a spectrum. Now we separate mental health from mental illness, and we realize they're on two different spectra. So here we have, this is called the dual continuum model of mental health. And we have illness on the horizontal axis. So a person can experience anywhere from severe mental illness on the left-hand side to no mental illness on the right-hand side. And at the same time, that same person can experience poor mental health functioning at the bottom to optimal mental health functioning at the top. So we have illness on the horizontal axis, and we have functioning on the vertical axis. And that divides the population at any given time, and it changes all the time, into 4 quadrants. In quadrant 1, you have the people who are experiencing good mental health with no mental illness, and we call that flourishing. The people in quadrant 2 are experiencing severe stress on their mental health with no mental illness. We call that languishing. People in quadrant 3 have severe stress on their mental health with a mental illness. That's languishing with a mental illness. And then in quadrant 4 are the people with good mental health and a mental illness. They're flourishing in spite of the fact that they have a mental illness. So this way of looking at mental health and mental illness reminds us that a person can experience significant struggle without illness. Those are the people in quadrant 2, or good mental health with illness. Those are the people in quadrant 4. And people move around. So wherever you might be today might be different than next year. The other thing this model does is it introduces the idea of mental flourishing, which is everyone in the top half. So I'm not a clinician, I'm a public health educator. I am interested in helping people, families, organizations, communities move up toward flourishing. Understanding mental health and mental illness in this way can also help reduce stigma. It's not about those who are sick and those who are well. It's really about all of us. And where are we now on this model? This is where I see one of the roles that public health can play in mental health, in offering education on mental health promotion and in helping all people, not just a subset, move toward their optimal mental well-being. So my next question is a poll. Where do you fall on this model right now? And remember, this is always changing. And for me, I experience some anxiety, and that puts me on the left-hand side. But it's not severe, and it's managed pretty well, which puts me in the top half. So I put myself in quadrant 4. Thank you for responding to this. As I expected, I am seeing answers come in that are in every quadrant. And that's typical. I appreciate you offering your honest responses for this. So I'm seeing quite a few people in quadrant 1, good mental health with no mental illness, and quadrant 2, severe stress without an illness. Some people who are struggling with severe stress and a mental illness, and then quite a few people with good mental health with a mental illness. So I can appreciate that we have a cross-section of people in every quadrant. That's common. If you are struggling with your mental well-being, I encourage you to reach out, get help, and remember that you are not alone in this struggle, and also practice some of the self-care activities that we will talk about in a few minutes. I appreciate being able to come back to this model myself, particularly during times when I might be creeping down toward languishing. It helps me keep my own needs for self-care and supportive resources at the forefront of my mind.
Cari, this is Sarah. Louisa shared in the chat, I have heard only 1% of the US population is truly flourishing mentally and physically, and that leaves a lot of people in need of support and very few people who are truly A-okay to help the rest. Any thoughts on that?
Yeah, thank you, Louisa. I didn't really have that figure, but I do know that it's a small percentage, and I do have a slide coming up that indicates that. And the concern about people not flourishing is not only that when you're languishing, you can become mentally ill, but also think about all the lost potential when you're languishing. We're not living up to our full potential. So thank you for that. I'm going to look that up after this and see where I can find more information about what percentage are languishing versus flourishing. I do believe that a lot more people during this last couple of years have been languishing. So if we're going to help people move up, we have to know when we're being successful. So what exactly is flourishing? There are several measures of mental well-being or mental flourishing now. I will show you an overview of a scale by Dr. Corey Keyes, same person who developed the dual continuum model. He says to flourish requires both positive emotions and positive functioning. These are the things that pull us into a healthy and engaged life. And by the way, this scale was based on the same concepts as the scale in the DSM for depression. First, to flourish, you need an emotional component, which means that you're feeling well. Mostly you feel happy, calm, mostly satisfied with your life, mostly interested in your life. Second, you need a psychological component, which means that you're functioning well as an individual. You have positive and warm relationships. You like yourself and your personality. You have self-acceptance. You have a sense of identity or purpose, or you believe that your life has meaning. You strive for personal growth. You're able to adapt your environment to meet your needs, and you have a sense of self-direction or autonomy. And third, you need a social component, which is really relevant during these past 2.5 years now, and now as we reconfigure our social circles if we've been isolated. This means that you're functioning well with others. You believe that people accept and care about one another in society. You believe that society is improving for people like you, or social actualization. You have a sense of community or connectedness. You contribute to society, and you believe your contribution is useful. And finally, you find engagement with people meaningful. You have a sense of social coherence. We don't need to have mastered all of these components to flourish in life. According to the scale, to flourish, we need 1 emotional component and 6 either psychological or social components. Given this definition, we can do a lot more than help people manage illness. We can do a whole lot to promote wellness. So the next question is one for you to think about. You can just jot this down in your own notes. Identify 2 or 3 of your own mental health strengths. And I will share mine as you're thinking about that. For me, I am fortunate to have a sense of community or communities that I belong to. These have been challenged for sure during the time of COVID, but I know they're still there for me. So part of my practice of mental well-being is staying connected to these groups of people. Another one for me is a sense of identity and purpose. This too is always changing and growing. Another part of my well-being practice is to regularly revisit these ideas of identity and purpose and make sure that I feel good about who I am and what I'm doing. That's been a really important part of my own well-being. Here's that picture. According to Dr. Keyes, a small percentage of us is experiencing depression. That's what's visible to other people. A lot more of us are not flourishing or are languishing. And as I said, that's concerning because it leads to depression, can lead to depression, but also we just aren't functioning up to our full potential. There are many, many ways that we can help people flourish. I'm going to share some ideas for your own individual mental flourishing. These are individual self-care activities based on what we know about well-being and stress and trauma and resilience. What I hope is that some of these resonate with you and you can incorporate them into a daily practice. First, we can work on accepting the so-called negative feelings of anxiety, worry, fear, boredom, loneliness, grief, anger as they come. Know that these are completely normal responses to stressful situations. By accepting our emotions as waves that come and go, we can ride the wave by experiencing it, feeling it, but not trying to block it or suppress it, and not holding on to it either, but moving on. We can shift our expectations for ourselves, for our children, for our family members, for our coworkers. This has not been business as usual, and we all have different needs during this time. Our needs will keep changing too. One thing in our organization that we've done is we created a COVID commitment, and COVID commitments restate organizational priorities during challenging times, during the pandemic. Organizations who use them recognize that business is not operating as usual. They adjust expectations so that workplaces are more effective and employees remain healthy and avoid burnout. They include things like welcoming flexibility into the day, right-sizing the workload, using paid time off, and those sorts of things. If you are experiencing isolation and it's hard for you, remember that it is temporary. Take small steps to build connections with people. I try to look for beauty outside my window, in my family members, in work colleagues, in nature. I live in the city, but I take walks and just notice things around me. Stress can lead to shallow breathing and an increased heart rate. So slow, deep breathing helps counteract that. Practicing mindful breathing, as we did at the beginning of the session, can be very simple. It doesn't have to be time consuming. Just every day, in through the nose, out through the mouth. We will put a link, Rick has already put a link in the chat to box breathing that we did earlier. Another grounding exercise is, for example, this is a exercise that can be really helpful during times of acute stress. If you can still your body and look around you, notice 5 things that you see, 4 things that you feel, 3 things that you hear, 2 things that you smell, and 1 thing that you taste. These actions can help orient you to the present moment, and that's in the chat as well. Next, take care of your body. Sleep and rest, stay hydrated, eat well, move and exercise as you can. My best self-care practice during this time has been to walk regularly, sometimes even just inside my house if I'm on the phone or on a meeting and I'm speaking. I don't have to be on video, just moving my body as I can. And keeping a gratitude list, writing down what we're grateful for actually supports overall mental wellness. Gratitude is associated with better physical and psychological health and increased happiness and increased life satisfaction. In one study, the more grateful cardiac patients reported better sleep, less fatigue, and lower levels of cellular inflammation. It's a lot of good results from keeping gratitude at the forefront of our minds. Meditation can be very small. It helps train you to focus and be aware of the present moment, and it also promotes emotional calm. Find small things to do regularly. This makes it more possible to incorporate them into your daily life. We are thinking of 1 minute, not 1 hour. For example, use that breath in and out to focus on the present moment as you're going throughout your day. Control your news diet. Ask yourself, what information do you want to take into your mind and thoughts? You can find a lot more about news diet with a simple Google search. What is helpful to you now? Choose what's most meaningful, not what happens to appear in front of you. Limit your consumption. Pay attention to how information is affecting your stress and worry and anxiety. Remember the activities that you enjoy and do more of them. They make us happy. Connect with others. Another thing that some of us introverts can forget to do, especially if we're out of the habit or feeling stressed. Communicate carefully. In times of stress, our communication methods can fall apart. Pay attention to how you speak and listen to others. In general, I try to speak carefully and listen attentively. Recognize that stress can affect how people communicate. Isolation can be truly challenging for some people. If you are able, consider it as a time of solitude. If you are able to be alone and feel okay about that, look for ways that being alone allows you to reflect and recharge. Laughter really is good medicine. In my family, we have created some silly little routines these past 2 years just for the purpose of laughing. Take the long view. Ask yourself, what do I want to be on the other side of this pandemic or the other side of this stressful situation, whatever it is? How does that guide my behavior right now? And finally, be a role model for others in your own self-care. We all need to take better care of ourselves. I'd love to shift our culture to place more value on this. The more we serve as role models, the easier it's going to be for other people to do the same thing. Next, we have a reflection for the chat. What is one self-care activity that you can commit to in the next week? And as you're doing that, I will share my own. I want to recommit to mindful walking. I mentioned that one of my best self-care activities is walking, and I am moving my body. I'd kind of like to get back to something I used to do, which is walking just around the block and noticing the trees or the fall beauty or the dogs in the neighborhood, but not having my mind go the whole time about what I need to do next. I'm not aiming for intense exercise or distance, just being present in that walk. I see in the chat many responses: meditation, exercise, getting outside to walk, reading, taking walk breaks at work, really good for me too. Lots of exercise and walking. Painting with a friend, very fun. I find yoga helpful as well. Getting together with friends at an apple orchard, that's great. Gratitude, deep breathing, Humor. It's a hard one for me because it just doesn't come immediately, but it's really fun when I am with family members. I have family members who I think just get together to make us laugh. And so it can really be a big stress relief. Do something I love to do. I think too, if for those of us who are caregivers, we often forget to do the things that we used to enjoy. So remembering what they are and finding little bits of time to do them as we can is great. So there's many, many, many responses in here. Thank you for all of your suggestions and also for making this commitment to yourself. I'm glad you're putting that at the forefront. It's really important. Okay, I'm going to move on. We have been talking up until now about individual mental well-being. If we're going to address everybody's mental health and be preventive about it, we know that we need to dig deeper into issues that are beyond the individual. Mental health is affected by things like inequality, poverty, neglect, racism, mass incarceration, injustice. This is another role that I see for public health and mental health. What are the underlying influences that affect mental health for whole populations? How can we create environments that are conducive to the mental health of everybody? Our mental health is affected by all these social determinants, and these are not affected equally by everybody. In fact, we know that racism is associated with higher rates of anxiety, depression, psychological stress, trauma symptoms, substance use, suicidal thoughts. Eliminating racism is one clear way to work toward promoting mental well-being. Racism, along with other experiences such as sexism or homophobia, present obstacles to many people in experiencing their best mental health. This is difficult to see, so Rick is going to paste a link to this in the chat so that you can go to that link if you are interested and see the full picture. But it's to give you an idea of a recent literature review that some of us did at the University of Minnesota and the Minnesota Department of Health. And it shows how factors at each level of this model influence an individual's mental health. This is a first attempt at identifying the research. It reflects an initial review of ecological systems theory and mental health. In studying mental health, we tend to over-focus on individuals at the center circle here, a person's individual risk factors and their resilience or their grit to overcome those experiences. But there are significant factors at each of these levels that affect an individual's mental health. Mental well-being depends on supportive relationships, the availability of organizations that can help us with anxiety and depression, also trauma and isolation and grief, neighborhoods and communities that recognize and support our mental well-being, as well as affordable housing, accessible employment, healthcare, education, and so on. Policies that allow us to receive mental illness care, as well as access the things we need to meet our needs. Societies that value mental wellness and equitable treatment and access to services and privileges, strong connections with one another. So mental well-being is about more than self-care. This also calls in the field of the discipline of public health and mental health, moving away from the individual to entire populations. We see risks at every level of this model. It reflects the importance of things as far-ranging as media messages, technology, social connections, poverty, resource allocation, government investment of resources. All of these have a direct effect on an individual's mental health and well-being. So a quick summary of what we've been talking about, and this is what I'd like for you to take away today. We have a complex situation that has led to increased mental health struggles. There are many lenses through which we can view those struggles and the concepts of grief and loss and trauma. I hope that the dual continuum model with the two spectra, with illness on one side and functioning on the other, gives you a new way to think about mental health. Please remember that your own self-care is the first thing, the first action to take as you explore this topic more fully. And I'm glad that our understanding of mental health has evolved, not only so that we can better understand the components of mental flourishing and be able to measure it, but also because when we view it through this larger set of lenses, that includes our life experiences, inequities, social structures, and historical experiences. That's when we really get the true picture of influences on our mental health and well-being. So my last question is one for the chat before I have a few resources to share with you. What is one new thing that you learned from this presentation today? I see flourishing versus languishing. That can be new for people, so I appreciate that. Breathing exercise, changes in the narrative. We're not alone. Box breathing. And there's many kinds of mindful breathing, and you can look it up and find them easily, but box breathing is just one that's easy for kids and easy for large groups and easy online. Difference between mental health and mental illness. Lots more about breathing and grounding exercises. And changes in the definitions. Quadrants. I think that the quadrants are particularly important when we feel stuck, if we're not feeling well and have the idea that we're going to feel that way forever. When I look at that dual continuum model and think about the quadrants, it just brings back to mind, oh, right, am I sinking down toward languishing? I can do something about that now. This isn't about waiting until I'm in crisis or waiting until things are really a big struggle. We all have a responsibility. And I do talk about that a lot because I do think that we have a portion of our society that are really very skilled in helping with mental illness. But I think there are so many things that so many of us bring to the field of mental wellness. All right, I'm just scrolling rather quickly through these, but I appreciate all of your comments about things that you have learned. I'm going to move on for these last couple of minutes to give you some resources. My last slides are first a set of helplines. These are national numbers that Rick will share in the chat with you. We also have local numbers within Minnesota, but I usually start with these. We do have a new suicide crisis line, 988. And then we have a number of extension resources that are available on the web. And Rick is also going to put these in the chat so that you can have the links to these. We have a 5-minute What is Mental Health video that covers the dual continuum model and ecological approaches that I talked about today, but condensed into 5 minutes. We have a trauma and healing video series and discussion questions about historical trauma and cultural healing and about secondary trauma. We have handouts and tips and workbooks related to stress and change. We have a Building Youth Resilience site about adverse childhood experiences and rural youth stress and dialogue with youth, how to talk to youth about all of these concepts. We have research reviews and narrated slides about rural health and rural stress and farm stress. We have an early childhood mental health toolkit with case studies and videos and research about child and brain development related to mental health. We have a piece about communicating under pressure that I mentioned earlier. We have 10 tips for engaging meetings. My financial capability colleagues, this is one of the ways that we provide support to families, have a link here to a short video about responding to sudden income loss. We have the organizational COVID commitment that I spoke about, and also the mental health and well-being ecological model that I shared. And you can find many more on our extension website. So finally, again, congratulations on taking time to focus on your own mental well-being as we support ourselves and our families and our communities. I invite my colleague Sarah Kroymans to speak about our remaining slides that might address some of the questions that you have. And then we'll have, I think, a couple minutes for questions at the end.
Thank you. Thank you so much, Cari. You have given us so much to think about and so many resources. And again, we will be sending a follow-up email either today or tomorrow with a PDF of the PowerPoint and all of the links. So if you weren't able to capture those, no worries at all. I also want to share that I did put in the chat as well some of our University of Minnesota Extension colleagues, Emily Kreckelberg and Jennifer McGuire, are doing some upcoming ambiguous loss and farming facilitator training. So if you work with the agriculture population, check that link out. They have several trainings coming up at various locations across the state. And thank you, Emily Kreckelberg, for reminding me to share that. On the screen here, if you need a certificate of participation or if you are interested in those University of Minnesota Wellbeing points, we can help you out with that. So Cari, if you go to the next slide, there will be the link for those for that evaluation, and Rick will be putting that in the chat. And Dana's saying that the link isn't working. Give it another try. It should be working. You can give me an email if that's not working for you. In addition, we will be sending a follow-up evaluation about 30 days after the end of this series, and we want to learn how you've used the information. Have you implemented some of the strategies that Cari has shared? And then with that email, we will be providing a playlist of all of the recorded webinars in this series. I had also put in the chat earlier our University of Minnesota Extension Center for Family Development's YouTube channel link, and we'll be including that in the follow-up email as well. Let's go to the next slide, Cari. We do have some upcoming webinars we encourage folks to participate in or to share with colleagues. The talks in Spanish, charlas en español. So if you are a Spanish speaker or work with folks or have colleagues, share that with them. We also have some webinars related to finding balance, later life decision making, and making sense of it all. So some financial capability webinars, and we will include these in the follow-up email as well. And as well as the link that's at the bottom there, so you can access these webinars as well as other webinars and courses and trainings from our colleagues in Extension. I think we have one more webinar here. We invite you to engage with us on social media. We'll include this in the follow-up email. Check us out on Facebook, Twitter, LinkedIn. We also have a family news e-newsletter, so you can stay in touch with us. We also have a You Got This text messaging program for parents and caregivers. So that as well will be in the follow-up email. One more slide here. I want to just thank everyone for participating today, and a special thanks to Cari for sharing her expertise and her the content and the resources that you have shared is just super beneficial. Cari, any last notes? And I know I see here some folks are having issues with that link for the webinars for the evaluation. We'll check that out. If it's not working for you, watch for that follow-up email, and we'll make sure we correct that situation. Cari.
I just want to note that I realize some people have had a difficult time accessing things, and I just put my email in the chat box. I am happy to help you locate those. They are all on our website, but there might have been something glitchy about them. So please reach out if you can't find something that you're looking for, and I can help you get to it.
And we'll be sure to include Cari's email in that follow-up email that'll be going out as well too. Thank you, everyone.
Thank you.
We will hang around here for a few minutes. If you have any questions, be sure to put those in the chat and we can address those, but we'll be hanging out for just a few more minutes. Have a great day, everyone.